Hello, good people. How are you doing today? Dominic here, and welcome to my health talk show today as we keep on educating each other. Yes, so as you are all aware, the month of October is Cancer Awareness Month. That is Breast Cancer Awareness Month. So I know many people have read and are aware of this month, but it's always good that each and every time you get to know something new. So today we want to talk about something about breast cancer, right? Especially on the warning signs and symptoms, on how you can be able to identify that you could be having a breast cancer or something else. Right? So breast cancer is when the breast cells mutate and they become cancerous, right? This is where the breast cells mutate and become cancerous and they multiply to form tumors. So when they become cancerous and they multiply to form a tumor, this is when now we talk about breast cancer. Another thing we need to know that breast cancer normally affects in large percentage women, but it can as well affect men or male. So it cuts across the gender, but the largest percentage of people who get breast cancer is the female or women, right? So we need to check on what could be or what are the main signs and the symptoms of breast cancer. Basically, that is one of the things that we need to check on. So when you talk about but before we check on the symptoms, there are different types of breast cancer. I may not talk much about the types, but just I'll mention, we do have what we call invasive, that is infiltrating ductal carcinoma, IDC. That is one of the type of breast cancer. There is what we call lobular breast cancer. That's another type. And there is another one called ductal carcinoma in situ, DCIS. Yeah, there is some other rare types, the likes of triple negative breast cancer, TBNC. There is inflammatory breast cancer, that is IPC. Then there is Behçet's disease of the breast. So those are some of the symptoms of breast cancer, or rather, those are the types, right? So now, straight we go into the symptoms of breast cancer. Number one, this is where I need you people to be very much aware of a change in the size and the shape or contour of your breast. So, women come with different, sizes of breast. We're not talking about how big or small, but if there is a change in size, you find that the size of your breast all of a sudden it has changed on its shape, especially when it's asymmetrical. When we talk of asymmetrical, is where the size for both is not, the same size. Of course, in one way or the other, most women have their two breasts of different sizes. But if you find that one breast all of a sudden it has become too big, the shape and the size has changed, then you may need to get worried and see the doctor. Then another thing, very important, a mass or lump which may feel as small as a pea. If you find that when you touch your breast, you feel there is a swelling or a lump, later on we shall talk about how you're going to do a breast examination, be it self or by a healthcare personnel. But if you find there is a lump or a swelling on either your breast, be it both or one of them, you need to go and get checked. It can be just a small lump or it can even be bigger. So that is one of the main signs and symptoms of breast cancer. Another thing is a lump or thickening in or near your breast, in your underarm, that persists through your menstrual cycle. I will repeat that. A lump or thickening in or near your breast or in your underarm that persists through your menstrual cycle. We all know that women, especially during their menstrual period, sometimes they may experience some changes in their breast, texture. Some may experience some pain or tenderness. Some may experience sometimes they feel like it's itching. Some may experience even pain. Some may experience even kind of enlargement. But if you find that those symptoms persist beyond your menstrual period, then you could be worried, right? Another symptom is a change in the look or feel of your skin or your breast or nipple. Your skin may look dimpled, puckered, scary, or inflamed. So if you experience such kind of a skin change in any part of your breast, always get yourself checked. Sometimes this can happen in a way that you find the skin is inflamed. Yeah, it becomes red. It's darker than it is usually. So if you find any changes of that nature, you need to get checked, right? So another symptom, an hardened area under your skin. So sometimes you find that the whole breast has become so much hardened. In normal circumstances, the breast tissues are soft, but if you find that all of a sudden the breast is becoming very hard, as you touch it, you find that it's very hard, you need to get worried, and it's good that you go and see your doctor for a checkup, right? So sometimes another symptom is if you find a blood-stained or clear fluid discharge from your nipple. So if all of a sudden you find that you are having a discharge from your nipples, that is could be blood-stained or even clear, it's good that you get checked, right? Although sometimes, if somebody's pregnant, you may especially get such kind of discharge. But if you're non-pregnant and you experience such kind of a discharge, it's good that you get checked. Yeah. So those are some of the main signs and symptoms of breast cancer. Yeah. So we may not go much into details, but other symptoms may come as the cancer, advances. Sometimes you may even get a wound that has formed if the cancer has advanced, right? But those are some of what we call the warning signs and symptoms of breast cancer, right? So we may not talk much into, their causes, the staging, the treatment part. That is much details. So, but I will mention another thing, that we do have some other conditions that may present with similar symptoms. Sometimes we have a condition called fibroadenoma. Fibroadenoma is non-cancerous, yeah, or what we call benign. Just you may find that you're having a lump that may happen. Sometimes you may have some other conditions like mastitis, that is an infection, and inflammation of the breasts. Sometimes you may have ductus atresia. There are very many other breast conditions that I may not mention right now. But today, I wanted you to know about the signs and the main symptoms of breast cancer. Next, we shall talk about what we call the self-breast examination. Yeah, especially for women. How will you be able to do self-breast examination? So, otherwise, I want to wish you well. Always know your health and stay safe. As I always say, health is wealth. When you have any problem or any query, just seek a medical advice. Go and seek your doctor's advice as you keep on getting more information. Otherwise, keep on subscribing to my YouTube channel, keep on following my page as I keep on educating you. Health is wealth. Bye.